Brooklyn Independent Television.
Coming up on HealthBeat Brooklyn.
And again, look up.
Macular degeneration. Because our population is growing older, this eye disease is on the rise.
I went to bed, I was fine. The next morning I woke up and all the windows were bowing and buckling.
The benefits of breastfeeding. No real debate here, though some new mothers need a little help getting started.
I think a lot of women expect that the baby will automatically know what to do.
In Sunset Park, encouraging creativity to cope with mental illness.
I came here for this, I came here for guitar, and I found much more.
And laughter yoga. As crazy as it may look, practitioners claim it's backed up by solid science.
Hormones and pheromones and epinephrine.
All this and more on HealthBeat Brooklyn.
Welcome to HealthBeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. There may be a few different reasons why you visited the eye doctor recently. Most likely, you needed a new prescription for glasses or contacts. If you're age 50 and over, it could be due to some other change in your vision. But do you know when that change might signify something more serious? A few months ago, I got a much-needed comprehensive eye exam on camera. One of the things my ophthalmologist was looking for is now becoming a major problem affecting adults age 65 and older. Macular degeneration. What exactly is it? And what treatments are available for this crippling condition? HealthBeat Sherry Carabin brings us a story of a woman fighting to keep her vision intact.
How are you?
Fine, doctor.
Good to see you. Come on
Good
back.
seeing you.
Let's take a look.
I woke up one day and I looked out the window of my home and the building across the street looked like it was bowing. And the windows were all bowing. The corners were buckling.
63-year-old Sheepshead Bay resident Teresa Catalano recalls the day she realized something was very wrong with her vision.
I called and made an emergency appointment. And they said they think that, I was having the problem, and I had to go see a retina specialist.
Have you noticed any changes since I last saw you?
No.
She was diagnosed with age-related macular degeneration, which affects the central portion of the retina known as the macula.
The macula is the part of the retina that's responsible for your straight-ahead vision. In an AMD, what happens is that aging changes begin to accumulate in that area that over time can subsequently lead to a loss of straight-ahead vision.
So, look straight ahead.
Macular degeneration, or AMD, is the leading cause of why people over the age of 50 lose their straight-ahead central vision.
Let's take a look at the left. Again, look straight ahead.
More than 8 million people in the U.S. alone have some form of age-related macular degeneration. There are two types: dry, which is the most common and rarely causes severe vision impairment, and the more serious wet type that Catalano was diagnosed with.
And again, look up. And look down.
The wet type has historically been the type that can cause a very rapid loss of straight-ahead vision over a period of a few weeks to months. The current mainstay treatment for wet macular degeneration is a series of medicines that we inject into the eye that are very effective at suppressing the problem. They don't cure the problem, but they suppress it, and in 95% of patients can stabilize the condition.
Catalano found out about her condition around 10 years ago.
At the time, they didn't have the injections they have now. My right eye will never get the center vision back, but I see peripherally on that eye. It's just center vision is gone. But now that I get treatments with these injections from Dr. Cooney every month, it sort of freezes it at that point.
So I'm going to give you a drop. Okay.
So that it'll never get to the point where I won't see, center vision with my left eye. And the right eye hasn't gotten worse.
Good. Keep looking up. Good. Doing great.
Doctors also recommend a well-balanced diet that contains plenty of green leafy vegetables, as well as foods that contain omega-3 fatty acids, such as fish like salmon or tuna, and nuts.
For early AMD or dry AMD, nutritional therapy in the form of a vitamin has been a mainstay treatment that has been proven through National Eye Institute clinical trials. This consists of a combination of antioxidants and zinc. They help slow down the progression.
It's also important to monitor the condition regularly using this Amsler grid and report any changes to your doctor.
As you're staring at the dot, ask yourself, are the lines around it straight, and do they all appear to be present, or is there a segment that is a blank spot? If the answer is everything appears normal, then you switch eyes and do it again to the other eye. And, as you can tell, this is not the type of thing to do every day, maybe once every other day, because you can start to desensitize yourself to this type of test.
While doctors don't know what causes age-related macular degeneration, there are a number of risk factors, including having a family history of the disease, smoking cigarettes, high blood pressure, cardiovascular disease, diet, and excessive sunlight. The most important risk factor is age. In fact, over 30% of those that are 75 years old have the condition. Are there any early warning signs that people should be aware of?
Early macular degeneration and even intermediate macular degeneration, oftentimes people are completely asymptomatic and have no symptoms.
That's why it's so important for people to get screened annually after age 50, because early diagnosis can help limit vision loss in the long run.
Go once at least to see a retina doctor to make sure you don't have it, because mine came and I woke up in one day. The night I went to bed, I was fine. The next morning I woke up and all the bricks were waving. And that means that it must have been starting up probably months before.
Yeah, everything went perfectly. So we'll see you in about 4 weeks, okay?
Yes.
Any problems, you let me know.
Yes, I will.
Okay.
This is Sherry Carabin reporting for HealthBeat Brooklyn.
New mothers want to give their babies the best start possible. And the medical community agrees that breastfeeding offers the best chance to grow healthy and strong. In fact, the New York City Department of Health has launched a campaign called Latch On NYC, which supports a mother's choice to breastfeed and limits the promotion of infant formula. Besides being free, breast milk provides the most complete nutrition possible. So with so many benefits, why the need to promote breastfeeding in the first place? Here to discuss this is Maureen Liberth, a clinical nurse specialist for the Women and Children's Services at Lutheran Medical Center. And joining us is Marsha Page, a mother of two. Thank you both for being here.
Thank you.
So today, how many women are breastfeeding? Do you have any numbers for us?
Nationwide, there is a large increase in the number of mothers that are starting to breastfeed. Among the Latina population, approximately 80% of mothers initiate breastfeeding at birth. Among the white population, about 75%. And among the African American population, about 70% initiate breastfeeding at birth.
I have to tell you, those numbers, my hunch is they don't represent Brooklyn, because from the experience I had working at the health center, far few people seem to be doing it. So what else do you see? Because you talked about Latinos, whites, and blacks. What about Asian women? Because Lutheran has a large Asian population.
Yes, we do. There has been, over the past few years, an increase in the number of Asian mothers that are starting to breastfeed.
My question is, with breastfeeding having all the advantages that I just mentioned, we didn't mention the in the middle of the night issue, but with all of those benefits of breastfeeding, why do we need to keep pushing it? What's the hindrance?
I think the biggest hindrance is a lack of education. I think a lot of women expect that the baby will automatically know what to do, and they need to give themselves the opportunity for both themselves and the baby to learn that the first few days takes a little practice.
You know, speaking of first 2 days, we have a mother who actually breastfed her two daughters. So tell us what it was like in the first couple of days.
The first couple of days were very challenging because, as Maureen mentioned, it's a practice. You have to teach the baby to, latching on was very difficult for me.
What was difficult about latching on, if you could just explain that?
Sometimes, like, the shape of the breast and the shape of the breast can have a lot to do with how the baby will latch on, and I had to make some adjustments with the help of the nurses at the hospital that I delivered to get my baby to latch on properly.
Well, sometimes when you first have a baby, especially if you've never breastfed before, the nipple doesn't come out. Was that part of your problem?
Yes, that was my problem, exactly.
And so what did they do?
There's actually it's a device, Medela makes it. It's a cup, and you can place it over the nipple area to actually bring it out.
A little suction.
Yeah, it's like a suction, and you could place it over the nipple area, and it will bring the nipple out, so it's easier for the baby to latch on.
So did the nurses help you with that?
Yes, they did. With my first daughter, who's 5, the hospital that I delivered at was North Shore, Manhasset, and the nursing staff, it was very important. They were so helpful and supportive, and they came in on their different shifts and actually gave me tips of how the baby could best latch on. Sometimes, when a baby is first born, they're kind of sleepy and weepy all the time. They don't want to really eat. They're kind of lazy. So they would tell me to take the baby's clothes off and put her inside of my nightgown, and we bonded, and that would help her to latch on and get milk.
It sounds like this is a key then in getting women to breastfeed. So what goes on at Lutheran?
Early initiation of breastfeeding, skin-to-skin contact at delivery is, as Marsha said, is a very important part. The skin-to-skin contact, allowing the baby the time, the opportunity. Several of our staff have been trained, have taken training courses in lactation, and we have support for the patients 24/7.
The men in your life, when you have a baby, play a role in this, because we know what breasts are for, but sometimes they get a little confused about the real function of breasts. So did you get support from your husband about breastfeeding?
I mean, my husband was very aware of how important it was for me to breastfeed because I knew of all the health benefits. But in the beginning, we definitely butted heads because he kept he felt the baby wasn't getting enough nourishment in the first couple of days because during that time, the actual milk doesn't come. The baby is feeding off of the colostrum. So he would be offering up this formula, and I was like, get away from me with that formula because I really want it takes a lot of patience. And he needed more, and so I wanted to.
But you were determined.
Yes, I was very
determined. But for people women who are less determined, who are unsure themselves, that could be already an issue.
Yeah, definitely.
Now, I have to jump to a question that a statement that I want. We'll come back and address this. In a recent Time magazine article, on the cover was a woman breastfeeding a kid that looked like he was about 4 or 5, and it says, "Are you mom enough?" And I took great exception to that because there are lots of women who have the desire, and for one reason or another, they can't. And in that instance, formula is perfectly appropriate. Right. But it raised the issue of how long is long enough to breastfeed. Now, we're talking about in Brooklyn, not in a nomadic tribe in Africa. How long is long enough?
Well, the American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months.
And why do they recommend that?
Because of the benefits of the breast milk, the bonding with the mother and the baby, the antibodies that the mother's milk provides to the baby.
Very important point that we need to stress.
Yes. I mean, multiple studies have shown that breastfed babies they get sick less.
Fewer ear infections, for example.
Ear infections.
Colic. All of those things are less.
Yes, less incidence of sudden infant death syndrome. They're healthier babies. There are studies that show that they're healthier children. The immunity that they receive stays with them as they grow.
It's a very important point because they don't have their own immunity when they're born. And so when the mother gives them theirs, it really helps them fight these infections. Yes. So how long did you breastfeed your first baby?
My first daughter, I breastfed her for 8 months. And my second daughter, almost a year.
So you stayed out of work for 8 months?
No, I actually went back to work after 4 months, and I pumped the breast milk from my office at work and brought it home to her. And I froze a lot of it for her child.
You were able to pump in your office?
Yes, I was. And I had a little refrigerator, and I stored it in there and brought it home with me at the end of the day.
But for women who are unable to have a private office and do their pumping, right now, what's going on in corporate America and the workplace?
Well, there are several companies that are breastfeeding friendly, and they do provide not only pumps, but a private place for women to pump.
Well, the New York City Department of Health does that. I have to say, they have lactation rooms, and they have advanced what they look like. When they first started their lactation room, it was not the best room, but now they have wonderful lactation rooms.
And other women that want to continue to pump will, they will find someplace. They will speak to their manager, supervisor, and try to be accommodated with someplace private where they can pump and store the milk. They can use a freezer bag if there's no refrigerator available. If they, they could bring a bag with freezer packs to store the milk until they go home.
One other point you made is that the American Academy of Pediatrics says breastfeed exclusively for 6 months. And one of the things that they're now saying is that children who are exclusively breastfed for 6 months have less problems with obesity.
Yes.
Is that still in the literature?
True. Yes. Their recommendation is exclusive breastfeeding for 6 months, but they recommend continuing breastfeeding up until age of 1 year.
So what kept you going? What kept you going with breastfeeding?
What kept me going was all of the health benefits that I knew that it could provide to my baby. And with my first daughter, she really had, I think, one ear infection, and that's a common problem with young children with the ear infections. And I knew that continuing to breastfeed would decrease that significantly. So I just, it's a lot of patience and a lot of work, but I knew of the health benefits, so that's why I stuck to it.
Now, one other thing I want us to get out are some of the other barriers that keeps women, other than the fact that the staff is not supportive enough. What are some of the other things that keeps women shying away from breastfeeding?
Lack of education and awareness of how important it is and of all the benefits.
What about having cesarean sections? It's not a contraindication.
Absolutely not a contraindication. And it also cannot be a barrier if the staff at the time in the hospital is willing to support and help the patient, help the mother to find alternate positions to make her comfortable so that she can feed the baby.
One of the issues is they say, oh, you're taking pain medication, so you shouldn't breastfeed. But if a baby was febrile in the hospital, what would they give them? They'd give them acetaminophen anyway.
Yes, they would.
So, one of the things we want to get out there is that the fact that you have to take something mild for pain is not a reason not to breastfeed.
No, it's not. The pain medication that most hospitals provide is safe. That the amount that passes through to the breast milk from the mother is so minimal that it has no effect on the baby.
If people have questions about where they can get information, because the best time to start preparing women is before they actually have the baby.
Yes.
If they have questions and you run the Women's Center, can you tell them how to get in touch with the Women's Center for counseling? Of course, women who don't go to Lutheran, you should ask your obstetrician about how to get counseling about breastfeeding before you actually have the baby.
They also, the patients, the women that go to our family health center are provided with education prior to coming in to deliver the baby. 311 information line.
Thank you for mentioning that.
The New York City has an information line on breastfeeding.
Yes, they do.
If you call 311, you can get information from them.
Thank you for that, for reminding me of 311. It is a good place to go, and we're going to have to leave that latch on NYC and call 311 as our last word. Thank you both for being here.
Thank you.
Painting, writing, arts and crafts, music lessons. Nope. That's not the art curriculum at your local grade school, or a list of summer camp activities you can do when it's raining outside. They're a sampling of powerful therapeutic measures used in a unique state-funded program for those with mental illness. In Sunset Park, HealthBeat's Maria Sandoval visited a center that offers a different kind of healing.
Sunset Sunset Park, a local center opens its creative doors to the mentally ill. But even that terminology is thrown out the window, as everyone here is considered part of the community.
We have our craft center where we can at any given time be making candles, playing with clay, doing beading work.
In this colorful center, no one uses the term patient.
We don't really use terms like that here because, again, it is a community resource. And everybody that comes here is simply a person.
The center, which opened last year, gets 500 visits a month. Anyone and everyone can attend the free program, and you don't have to bring a doctor's note or a medical file.
It's been a tough year for me, but this place has been there for me because they have all sorts of programs, all sorts of things that you can do to relieve your stress and like forget about the day-to-day tasks that you have to do.
Giselle regularly attends a guitar class. Music is her way to escape from the stresses of unemployment.
I came here for this, I came here for guitar, and I found much more, and that's what brings me here today.
She couldn't even pick up the guitar in front of everybody. She would have to go in a corner and just play like that. But now she actually jams with me one-on-one, as you saw, and she loves it, and she's writing her own songs, and she's improvising, which when she first came, she told me that's what she wanted to do, but she felt like she didn't know if she could.
Peer specialist Houdini had his own story as well.
I started to struggle personally, just having tough times at night, going to sleep, started dealing with panic attacks.
He served in the Army 3 years ago and found music as a way to deal with the breakdowns.
It's restorative, so I really made it through tough times through music, through playing, yeah.
Now Houdini helps others like him find release in music.
There were no words to see how people reclaim their creative energy, regardless of the voices they have been told they are, the stigma that has defined them.
And while more studies are needed, there is a growing support for the idea that art therapy may have a positive impact in aiding the mentally ill.
Our center is unique. We are the first program of its kind in the 5 boroughs. I might even venture to say in more than the 5 boroughs. We do not have a prescribed structure. This is something that we, the peers, cooked up together over the course of many years, dreaming of what kind of space would help people heal.
Funded by the New York State Office of Mental Health, the Wellness Center does not consider art therapy as the end-all cure for mental health illness. Instead, it is a resource, a way for people to connect and become a part of a community, instead of just being a patient. For HealthBeat Brooklyn, this is Maria Sandoval.
If you're doing it right, yoga demands quiet and concentration. There's no house music blaring when you're getting into downward dog, is there? In short, this ancient practice is no laughing matter. Well, maybe not quite. In fact, HealthBeat's Julia Vassie took us to Park Slope, where a new style of yoga demands that you laugh your head off to get healthy.
They may look like a bunch of wackos, but their hysterical laugh is not a symptom of illness. It's a special therapy called laughter yoga. Ho, ho, ha, ha. This man is a beginner and is still shy about laughing out loud.
I was a little nervous coming over here because I didn't know what to expect. The whole idea of just coming and forcing laughter just sounded a little crazy.
But after a while, he decided to go with the flow.
I felt very peaceful and happy, and I was looking at everybody and I could listen clear. I forgot about all my problems for the day.
Everybody get ready. We're going to pull our motors the old hand crank style. Okay. Start. Aha! Wow! Wow! And
Caroline got addicted to laughing 3 years ago when she discovered that it helps control her diabetes.
I have type 1 diabetes, which means that I have to check my blood sugar anywhere from 4 to 10 times a day, in addition to giving myself 5 shots of insulin a day and counting carbohydrates in all of my meals. I've had this since I was a teenager, and it can be pretty stressful sometimes. Not only all the work that you have to do to just keep up with everyday life, but also all the times when you do everything right and still the number comes out higher or lower than you expect it to be. And so laughter yoga really helps me to laugh away the stress instead of beating myself up or feeling guilty or angry.
She even became a certified laughter yoga instructor.
I first heard about laughter yoga when I was a student at Cornell University. The school mental health awareness group held a laughter yoga session, and I went and I was hooked. So after that, I decided to become a laughter yoga leader and moved to New York City and started leading more sessions here.
Is laughter really the best medicine? Studies show when you laugh, lungs expand by 30%. Oxygen streams into the brain and accelerates its activity. It also boosts blood vessel health. Instructors recommend that you laugh 5 times a day for about 5 minutes.
There's, of course, the physically scientific side that deals with hormones and pheromones and endorphins and cytokine and epinephrine and immunoglobulin. Those are the buzzwords.
Vishwa is one of the first instructors who introduced laughter yoga and infected New York with laughing in the 1990s. 10 years ago, there were just 3 laughter yoga clubs in the United States, and now the number has grown to over 400.
Laughter is discovered by the PNI people, that's the psychoneuroimmunology, a new field in medical science which deals with how emotions affect our physical health. If people have come in with a lot of stress, with worries, with things bothering them, then just a few minutes of laughter will chase that away. So laughter reaches out to something far, far, far more than just the body.
It helps strangers to connect. Many students who force themselves to laugh in the beginning can't stop giggling after class. This yoga is often offered for children with special needs, as well as in retirement communities, prisons, and psychiatric institutions. Normally, classes are free, as a good laugh is priceless. For HealthBeat Brooklyn, this is Julia Vassie.
That's all for this month. If you want to watch past episodes of the show, go to brickartsmedia.org/BIT and then click on HealthBeat Brooklyn. And you can follow us on Facebook or Twitter on BK Independent TV. Right now, information about the programs and hospitals we've just featured is about to appear on your TV screen. Thanks for watching and stay healthy.
Watch this and other Brooklyn Independent Television episodes online at brickartsmedia.org/BIT.